Good afternoon. I'm Tom Putnam, Director of the John F. Kennedy Presidential Library and Museum. On behalf of David McCain, CEO of the Kennedy Library Foundation, and all of my library and foundation colleagues, I thank you for coming and acknowledge the generous underwriters of the Kennedy Library Forums, including lead sponsor Bank of America, Boston Capital, the Lowell Institute, the Boston Foundation, and our media partners, the Boston Globe, WBUR, and NECN. Programs like this one would not be possible without your support. We thank those of you who are members and ask those who are not to consider taking out a membership by visiting the library's website. Earlier this year, I was afforded the extraordinary opportunity, along with my fellow library directors and the Archivist of the United States, to take a tour of the newly renovated museum at the Jimmy Carter Library with President and Mrs. Carter as our guides. Not surprisingly, given President Carter's training as an engineer and his wife's well-deserved reputation as enterprising global activists, the new museum includes the most creative, state-of-the-art, and engaging exhibits within the presidential library system. Despite the fascinating interactives on the presidency and post-presidential years, I was most struck during my visit by the selfless dedication of President and Mrs. Carter, informed by their childhoods and courtship in rural Georgia. As Mrs. Carter writes in her autobiography, on the morning of her husband's inaugural, she knew that the man who took the oath of office that afternoon was the very same person who, the day before, had helped her mop up water in the garage of their home in Georgia after a water pipe burst from the cold. Quote, though we faced extraordinary responsibilities and lived a life we could have never, ever dreamed of, she writes, we are first and always Rosalynn and Jimmy Carter from Plains, Georgia. We all recall the honesty and transparency that Carters brought to our nation's capital at a pivotal moment in our country's history, symbolized by their decision to walk down Pennsylvania Avenue, preceded only by Thomas Jefferson, who also traveled from the Capitol to the White House on his own 2 feet. While those may have been Mrs. Carter's first steps as First Lady, they were familiar to her and a tireless march for the causes she believes in, especially in her efforts to improve the lives of those living with mental illnesses. The genesis of this interest she describes in her new book, stemmed in part from an encounter during her husband's campaign for governor. Shaking hands with workers at a cotton mill, she met a very tired-looking woman at 4:30 in the morning who had just clocked out from the night shift. When Mrs. Carter encouraged her to get some rest, the woman explained she was headed home to take care of her daughter, who was mentally ill, while her husband headed off to work himself. Mrs. Carter campaigned the rest of the day and then stood in line at one of her husband's late-night rallies, taking her turn with others waiting to shake her husband's hand. What are you doing here? Mr. Carter asked when he came to her in the line. I came to see what you're going to do to help people with mental illnesses when you become governor, she replied. As he made his way to the next person in line, he answered, we are going to have the best program in the country, and I'm going to put you in charge of it. And that he did. Mrs. Carter served as a member of the Governor's Commission to improve services to the mentally and emotionally handicapped, and later as the honorary chair of the President's Commission on Mental Health, which led to the passage of the Mental Health Systems Act in 1979. Never one to back down from a fight, she testified before the Senate on behalf of the Mental Health Systems Act, despite the fact she was counseled not to do so, as the committee was chaired by Senator Edward M. Kennedy, soon to be her husband's rival for the Democratic nomination, but who was an ally with her on the fight for the rights of the mentally ill as a moral issue facing our country. In her testimony that day, she stated, the mental health problems facing our country are the problems of all citizens. The people with these problems are ourselves, our families, our neighbors, and our friends. She continues this crusade today through her work at the Carter Center, where she created and chairs the center's mental health task force, and I should note she counts Senator Kennedy's son, Congressman Patrick Kennedy, as a friend and collaborator in this cause. Her newest book, Within Our Reach, Ending the Mental Health Crisis, is on sale in our bookstore, and Mrs. Carter will sign copies at the conclusion of this program. Mrs. Carter will open the forum with a few words and then have a conversation with our moderator, Dr. Peter Kramer. described by the New York Times as possibly the best-known psychiatrist in America. A professor of clinical psychology and human behavior at Brown University, Dr. Kramer is the author of numerous books, including the bestsellers Listening to Prozac and Against Depression. Joyce Carol Oates describes him as an analyst of exceptional sensitivity and insight, writing to read his prose on virtually any subject is to be provoked, enthralled, and illuminated. We could have no better moderator for this afternoon's session, and we thank you, Dr. Kramer, for being here with us today. During my trip to Atlanta, I admit to beginning to feel tired after the 2-hour tour of the Carter Museum and the Carter Center, and amazed by President and Mrs. Carter's seemingly boundless energy. When we next sat down around a conference table to hear them describe their recent trip to Sudan, where they had led the effort to eradicate guinea worm disease and where the Carter Center monitored the recent democratic elections, I felt humbled to be in their presence and in awe of their tireless perseverance, abiding faith, and indefatigable efforts to alleviate suffering and create a more peaceful world. Mrs. Carter, you honor us here with your presence, as you did at this library's dedication and opening 31 years ago. You and President Carter exemplify the very best of our nation, and paraphrasing President Kennedy, the energy, the faith, the devotion which you bring to these endeavors has lit our country and all who serve it, and the glow from that fire truly lights the world. Ladies and gentlemen, please join me in welcoming First Lady Rosalynn Carter.
Thank you very much. Thank you. Thank you. Well, it's good to be here and to see so many people in the audience interested in mental health. That always makes me feel good. So thank you for coming. And I have worked on mental health for a very long time, and I worked with Senator Kennedy, as you said, and I've worked with Patrick, and Patrick was at the Carter Center on Thursday. We had a program on National Guard and Reserves, the problems of these troops coming home suffering from PTSD and traumatic brain injury. And he opened our session and gave a really, really wonderful speech, and then I had to follow him, which was a little difficult. But he makes such good speeches. Once when we were at a mental health meeting, and we had something had happened to, I don't know whether it was parity had not passed because we worked on parity so long. Anyway, we brought a lot of people together to see what we're going to do next. And Patrick got up and made a speech, and I agreed with everything he said. It was so good. Every time he makes a speech, I want to do more and more and more. So I went up to him and I said, Patrick, I think you ought to run for president. Well, he hasn't forgotten it because he tells a story every time I hear him about me, and I just think the same way he does about issues. And so, well, I've been looking forward to coming here, and I have been working on mental health for a very long time. In fact, Jimmy was inaugurated governor in 1971. So in January 2011, I will have been working in mental health issues for 40 years. That is a very long time. I did become involved campaigning for Jimmy the first time he ran for governor. He ran once and lost, and he was actually in the state senate running for Congress, and our leading candidate, Democratic candidate, had a heart attack and left Lester Maddox. Are you familiar with Lester Maddox? Our only Democratic candidate. And no, we had one other, but it was a little bit insignificant, although a good man. But and Jimmy went to Atlanta because nobody had announced to run against Lester Maddox, and we had a Republican candidate first time in 100 years running for governor. And so Jimmy went to Atlanta to see who was going to run, and nobody was. Lester Maddox was very popular. You remember this is in the late 1960s. And so I was going home from our peanut warehouse. I was keeping our business while Jimmy was gone. And his mother lived between us and about halfway between the office and my house. And she called me in, and Jimmy was on the phone. So I went in, he said, "Are you sitting down?" And I said, "No." He said, "Well, you better get a chair." And then he told me he was going to run for governor. Well, it was all very sudden. And we only had, I think, maybe 7 or 8 weeks to campaign. But you couldn't just let him have it. No, not this. He was a big segregationist. And so this is the first time I had campaigned. He was in the Senate, but I had done telephone calls and things, but I'd never done any campaigning. And everywhere I went, people asked me what my husband would do for someone with mental illness. And I kept getting the question. And it was a time when the Community Mental Health Centers Act had been passed, and people were being moved out of the huge institutions. But the Community Mental Health Centers had not been established yet. And so they were going from the institutions just into the communities with no services. And so every day, and I did meet that woman, but it was after I had just heard it day in and day out, and I became really distressed about it. And Jimmy did appoint the Governor's Commission to improve services to the mentally and emotionally handicapped. I would take the "the" out of that if we did it again, but this was 1971. To the mentally and emotionally handicapped. You don't say the mentally ill anymore, you say the person with mental illness. So every time I look at that, I think how wrong we were and how little I knew back then about mental health. I was a member of the commission. He didn't put me in charge of it, although he said he was going to, but of course he didn't because I didn't know anything about the issue. But he did set up the commission, and my job was to tour the facilities in the state and come back, not in a critical way, but just to go and see what was happening and come back and report to the commission, which I did. And then I got more and more concerned about what was happening after seeing the institutions. And what we did when Jimmy was president, we set up 123 community mental health centers. Now, these were by no means comprehensive. Some were just an office in the middle of a small town, or in larger cities we did other things, but in many towns just an office with a telephone so that somebody could go by and find out where to go for help. But and at the same time, we were trying to get homes for mentally ill. And I remember going to one town in Georgia. I was going to talk to the city council about a place that we wanted to establish a home for some young people. And I got off the airplane at the airport, and they told me that the city council voted the night before not to do it. It was really interesting situations back then. Nobody would talk about mental illnesses. Nobody wanted to be involved with it. I would call meetings, and the people who would come, but I didn't tell you about my 5 advocates. When I said I was going to work on mental health issues, all the advocates in Atlanta descended on me, all 5 of them. And that was it. Nobody would talk about the issue, but they would come to my meetings, and maybe a few employees, a few government workers, because Jimmy was governor. It took us forever to try to get a group together that would work on the issue. It was an interesting experience, to say the least. But then when we were in the White House, Jimmy appointed the President's Commission for mental health, on mental health. And we actually worked hard and developed legislation and passed the legislation was passed and funded. That was in October of 1980. In November of 1980, as Jimmy says, he was involuntarily retired from the White House, and my mental health legislation was gone. The next president abandoned it. It wasn't perfect, but it could have made a considerable difference. It was one of the biggest disappointments of life. Even more distressing is the fact that 25 years later, a second presidential commission concluded in 2002 that the mental health system in the United States is in a shambles. And that's where we are now. And then when we looked at the recommendations of the second commission, it was shocking to see how many of them were the same ones that we had in our commission in 1978. Filling the gaps in care for children and for elderly citizens, correcting the shortage of trained mental health professionals. Just think what it would have been if we had incentives for mental health, for young people to go into mental health as a profession, to choose mental health. And now look, we just have, we are so lacking in mental health professionals. Especially those serving minority populations and providing adequate support services for those suffering from serious mental illnesses. We had a program for those with serious mental illnesses in the legislation, but very little has been done in this whole length of time, except that when George Bush was president, he increased research considerably. Jimmy had increased research, and then George Bush increased research. And that from that research is what we know today about, and that's one thing that has developed the research that we know and the knowledge of the brain that we know now. Since I first began working in this field, I've met hundreds, even thousands of citizens, young and old, rich and poor, people from all walks of life, who have shared with me their personal stories of pain, suffering, and even loss of a loved one because help was not available. And what is so sad is that we know what to do. We know what to do. We've learned so much about the brain and the power of individuals to recover, even from serious mental illnesses. We have excellent knowledge about effective treatments and good models for delivering them. We have early intervention strategies to prevent more serious problems later in life. We're even beginning to understand how to promote resilience in children at risk and those struggling with the most serious disorders. Well, many people ask me why I decided to write my book. And actually, I did write one in the late 1990s. And I have a very good task force, mental health task force at the Carter Center. And they wanted me to update it. I started looking, but I felt a kind of an obligation to do it anyway. But then when I looked at it, it was so out of date, everything has changed, that I decided I had to write start on another book. I want people to know that mental illnesses can be diagnosed, they can be treated, and the overwhelming majority of people can live full and productive lives in the community. And people don't know that. That's one reason I wrote the book. But I want everybody to know what I know so we can get over the stigma and go on to do what is good and right for people with mental illnesses. Well, thank you. The themes of my book are recovery. It's possible for people to recover from mental illnesses. And that is something we never dreamed of when I began working. In fact, in 1978, when we were working on the President's Commission on Mental Health, we didn't even mention recovery. It was not something even then that we ever thought was possible. But hope plays an important part. And the social movements like the peer support program with people with mental illness, talking with others and helping them. And it's been so wonderful to see what happens because they treat them, the consumers, those living with mental illness, treat the others with respect And one of my members of my task force, who is a consumer living with a mental illness, said that if respect is not there, then it's nothing. Everything is respect. And now he's in Georgia. He is a consultant, and he teaches people, doctors and people in the mental health field, to work with people who have mental illnesses and teach them how to show respect. He's going all the hospitals in Georgia now doing that. And recovery is one. Prevalence, mental illness affects all of us. They touch every family in our country. 1 in 4 Americans is diagnosed with mental illness every year. 1 in 4. And this is the one reason I cannot understand why stigma is still so bad, because everybody knows somebody, if not a family member, a close friend, living with a mental illness. Stigma is the third thing. Stigma is the greatest barrier to seeking care for individuals who have mental illness. The greatest barrier for a person with a mental illness, and it's the greatest barrier for those of us in the field who are trying to do something about it. Prevention. Early intervention and prevention have the potential to reduce the risk and severity of mental illness, especially among children. We have learned that mental illnesses are developmental illnesses. And if we can, the sooner we can, they can be diagnosed, then the better it is, because sometimes it always helps. It always mitigates the consequences. But sometimes it can even prevent another episode later in life. And so it is so important to watch babies. I want mothers to know to watch their babies, so that and just watch to see how they bond with their parents, whether or not they meet the age-appropriate milestones, like when they crawl, when they walk, and so forth, and how they react with peers, with their classmates, even from nurseries in very little, very young ages. It is so important. If there is any deviation, parents must take their babies to see a doctor, a mental health professional. And someday I'm dreaming of the time when people will be taking their babies to a mental health professional for a checkup, just like you take the baby to a doctor, medical doctor, for a checkup. And I hope that day will come. Well, I hope my book will help dispel the myths and misconceptions about mental illnesses that cause so many people to keep their problems hidden and hinder all our efforts to help them. Ultimately, the way we treat people living with mental illnesses is a moral issue. To neglect those who, through no fault of their own, are in need runs counter to our values of decency and equality. Today, with our knowledge and expertise, we have a great opportunity to change things forever for all people with mental illnesses with what we know now, to move forward to a new era of understanding, care, and respect. Thank you very much. That I came back to this.
Well, what an honor it is to chat with you. It is, Tom Monaghan said, it's humbling to be up here with you. And it is, and I think not just because of the aura or mantle of the presidency. We were backstage and you were talking about your schedule, and I thought one could be in awe merely of the energy and focus. You're involved with so many important issues. And I want to go back to the beginning, because I think the mental health field and the mentally ill have been very lucky that you have chosen this issue as your central one. And to ask, again, how is it that happened? Because I think people must have come up to you with questions about women's rights and civil rights and care for the elderly, all issues which you since have gotten involved with. What was it, not just in these voters and constituents, but in you, that allowed you to choose this issue, which was not mainstream at the time?
Well, Jimmy lost the first election, and Lester Maddox was elected. And 4 years later, he won.
Yes.
And in that length of time, I looked at the issue, and we had been to Central State. Jimmy had a cousin at Central State Hospital. That was a big institution. We didn't see anything except a few people they had chosen coming in for a little tea. This was before he was elected governor, after he had won. And so he didn't see the bad situation. And then also I went, and I had already decided that maybe that was what I'd work on. And after he was elected governor before the inauguration, we went to North Carolina to a conference for the governors and the incoming governors with the governors, ones that were already governors. And so I had sessions with the incoming governors' wives and I don't think there was anybody there from other governors except the wife of the governor of North Carolina. And she told us that everybody with a cause was going to come to us and ask us to work on their cause. And the best thing to do was choose one issue, and then you could just have an excuse and say, I'm working on mental health.
Yeah.
And so that helped me decide, and you were right, every issue came along. But by then I was so engrossed in mental health and working with that issue.
And you actually went and did something like clinical work. You worked with many other people.
When Jimmy was governor, I went to Central State several times, and it was awful. There had been 12,000 people there with room for 3,000. They were packed into rooms, and the people were sitting in chairs with tied, they weren't straps, but they were like diapers tied around them, and they were rocking like this. And now this is how much I knew about mental illness at that time. We would get a mirror, we'd try to make them smile, and we'd hold a mirror up to them and say, smile. And every once in a while somebody would smile, but most of them didn't. They were just sedated. And it was so bad. But then one thing that happened was that when Jimmy started, took one Air Force base, Army base, some base in Georgia that was not being used anymore, and made a mental health center out of it, moving people out of the hospital. And I visited some of those, and it was so interesting because here were people who had been in the institution. People back then just put their loved ones away, and there's 30,000 graves at Central State of people who were not claimed. That were put there and just stayed there for the rest of their life until they died. And the cemetery was just found not very long ago, and they've cleaned it up in a plaque there. But they would move them out, and I would visit these facilities, and you see these people, they let them choose their clothes, which they never made. They hadn't made a choice forever of anything. They let them go through cafeteria line and choose what they wanted to eat. It was a new experience for us. It was so wonderful to see what happened to them. And I remember watching two sitting on the steps. It was steps that went down to off of a porch. And I was standing behind them, and one of them had a cigarette, and the other one wanted a puff. And he kept trying to reach over. There were no social connections. And he was trying to reach over and finally touched him enough to ask him for a cigarette. Probably the first time this man had ever, it was just so wonderful to watch and to see what could happen when people had a chance. This was not much of a chance, but it was a total difference. And the more I learned about the issue, and and the treatment people got. I always said they got what was left over after everything else was funded, everything else in health, which was nothing almost. It was tragic.
Yes. I mean, that is the complaint of the field, that it always gets the scraps, it always comes last. The standards for it are
still
higher.
does.
I mean, I was going to ask a question which it almost has been answered, but that you seemed at first to have an affinity for the families of people with mental illness, but it's lucky in a way that you also had an immediate and easy feeling for people with mental illness. And I wonder why that is, because that's certainly not universal, that people can enter a state mental hospital and see people there.
I don't know why. I don't know, but I did. I felt that. I just felt like they needed help, and that nobody was helping them, and nobody wanted to be involved with helping them. And when I was growing up, we had 2 people at home with mental illnesses. And this, of course, we knew nothing about the brain back then. There are a few treatment methods, mostly just out of sight and sedated. And one was Jimmy's cousin, who would come home, and he would walk up and down the street. We have one street in Plains, a block long of stores. He would walk up, and sometimes I would be walking down the street. He'd come up and frighten me, and he would get the way he was wringing his hands and getting louder and louder, and then he'd go back to Central State, and they would come in a police car and take him away, because back then you could put them away anytime you wanted to. In fact, there was a woman in Plains who had a husband put in Central State, and nobody ever knew whether he had a mental illness or not. Yeah. But I don't know. And the other one, her father locked the door at night because he was afraid of her. And, you know, I heard stories like that, so I don't know why I felt so strongly that I needed to do something about it. Well, but the more I thought about it, and then when I was when Jim was governor, I went to I volunteered at our local hospital, one of the hospitals in Georgia. Instead of doing community centers, they had already built this one hospital, and they built, I think, 4 more in the state, 4 or 5 more in the state. And I used to go and volunteer out there. But it was just, you know, to see people out planting flowers in the garden, and knowing they had a mental illness, knowing that back then we had no idea that they could ever live fulfilling lives.
What do you make to be the difference? Because I think it's true, whatever the limitations of our abilities now, that there are extraordinarily more opportunities for the mentally ill now than there were then. I mean, what are the changes that you've seen in the way we treat patients?
Well, I think we've learned so much more about the illnesses, and that they're biological like other illnesses, and I just think it's made all the difference, the research, and what we know. There's one other thing that made me want to stick with mental illness, and that was that I got to know Margaret Mead. She came to see me when she heard I was going to work for on mental health issues, and she said if we become interested, I'd take the least vulnerable among us as our something we want to help. I don't remember exactly how she said it. Then our whole, then we humanize our culture. And you can see that when you work with people like when I did, when people were just sedated and knew nothing, and now we realize they're human beings with hopes and dreams and thoughts just like everybody else. They want to have good lives, and we still don't treat them that way.
I want to hear more about the encounter with Margaret Mead. I'm remembering, as you say this vaguely, reading in your memoir that you were a bit despairing, maybe a bit anxious at some moment, and she came in. This was maybe 1971, and I wondered more about what the encounter was, and also what she said, because I think probably what she believed about mental illness is somewhat different than what we believe today.
It's in my book. But she came to see me and she said it's going to be hard, which was true. And then she came back to see me when Jim was elected president. And then we went to Vancouver, I think. Anyway, it's just a great experience to be with her. Yeah. But she talked about the most vulnerable among us. Yeah. If we take for our first consideration the most vulnerable among us, go ahead. You can go ahead and talk.
I may want to jump to another issue as well, which is it's hard not to ask you political questions when we're up here. But you write in your book about issues that contribute to the crisis in mental health that are effectively political issues. We send young men off to war quite regularly. They come back. Nowadays, they're less likely to be killed, more likely to come back in terrible shape, physically and mentally. We incarcerate people more than most other cultures. We use solitary confinement more than the advanced cultures in Europe, relative even to the incarceration rates that they have. And I wonder, are you optimistic or pessimistic about this changing? What's your view about the politics that impact on mental illness?
Well, we just had a session on National Guard. I said that in my remarks. And that's going to be with us for a long, long time, with people coming back with PTSD and TBI. And I don't quite understand your question.
Well, I've complicated it too much. You are going around the world looking at enormous issues of peace and war, as well as looking at mental illness. And I just wonder what the outlook is. We've just been through an election which is discouraging for liberals and Democrats. I wonder what you see on the horizon in that way.
And for mental illness?
Well, I think that issues like Afghanistan.
I don't see the things I would like to see on the horizon, particularly after this election.
What about incarceration? You write a great deal about prisoners. What sorts of reforms do you want to see there?
Well, the prisons and jails are the largest mental institutions in the country, and it is tragic to me when somebody who is homeless on the street, living with mental illness, gets hungry, goes into a restaurant, has a sandwich or a cup of coffee, gets up without leaving, and they take him off to jail. That is tragic. And but there's some good jail diversion programs now. In my state, there's some. We have a mental health court, courts, and I think there are other states too, but I'm familiar with those at home. And the one close to my home, 35 miles away, has a nurse, somebody at the prison that can, when anybody comes in, they determine whether they have a mental illness or not, and send to the mental health court. I've visited the mental health court, and it is incredible to see what happens. When the one I went to, they go and the court will be responsible for them for a year, and they have social workers that kind of look after them to be sure they're getting along all right, and then they come in every once in a while to see the judge. And when the first day I went, courtroom was kind of small. It wasn't like a huge big courtroom. It's scary a little bit to me. And the first person that came in, he said, Mrs. Carr, I'm not going to be very formal. It's not my style to be too informal, but I'm not going to be really formal. Well, this first young woman came walking in, and he said, oh my, you look so good today. How you got along? And I mean, it's just totally different from the way we look at people with mental illness, as the way they're treated naturally. Like she was this wonderful person who had this mental illness and she'd gotten her children back and had been taking care of her mother who was sick, had gotten a job, and just living a good life. And she would have been in prison. Look what would have happened to her. She would be worse. To go to prison is worse for people with mental illness.
No, they're terrible places. And as I said, I think there's some political issues around the question of how much incarceration there is. I want to ask about stigma, which is one of the themes in your book. You quote a study which I thought was interesting that says, if I'm getting it right, that people today say they're willing to make friends with people with mental illness. They may actually have friends who have mental illness, but they're less likely to accept them as family members or want them as family members. And I wonder what you think is going on. And I'm going to say something I think I see on campus because I practice near a college campus near Brown, where I think we may have traded moral stigma, where in the past people were blamed for being lazy or not trying enough or not having willpower, for biological stigma, so that you might not want your child to marry someone with mental illness out of a fear having to do with genetics. And I wonder whether the nature of stigma changes as we define diseases as less moral or even less psychological and more medical.
Probably.
What do you see? I mean, let's make it a broader question, which is where do you see stigma as getting in the way of change?
Are you familiar with a new report done by Columbia University and Indiana University?
No.
Because we've been working with Columbia on Columbia University likes my mental health fellowship program, so we've been doing a lot of work with them. And this study was, the conclusions were written up, and I got one. It was dated September 15. It says that 85% of people now recognize mental illness as neurological illnesses. It has had nothing to do with stigma and discrimination. It says that stigma, in some cases, the knowledge of the brain and the talk about that and must frighten people, because and the mental health community has always thought, what we always have been trying to do is say it's a disease like any other disease.
Yes.
And that is backfiring, and evidently sometimes it's even making stigma worse to know about something wrong with the brain.
I hadn't known the name of the report, but I had read that conclusion, and that was very much along the lines that I was thinking. It turns out to be very hard to make people comfortable with mental illness, and the frame isn't the whole story.
I think the main thing is the fear factor. And what people don't know is that people with mental illness are much more likely to be victims of crime than they are to be perpetrators of crime. 4 times more likely. In fact, this stigma article that I read said that it was a lot, 10 to 20 times more likely for a person to be victimized than the average person walking down the street.
I want to ask about the President's Commission on Mental Health and the Mental Health Systems Act. I was, I guess, just entering the Carter administration at a low level in mental health when that act came through, and I know some of the principles. And you write, I think appropriately and bitterly, about the act not going into effect. But I went back and spoke to some of the doctors involved, and they said, well, you know, that act had a good deal of effect conceptually, and that much of what has happened both in the states and federally in terms of parity, which is this ability to have equal effective insurance for mental illnesses as for other illnesses, that a good deal of that change is really attributable to the work of the commission. And I wonder what you think, with a broader look, about what was important about what you did and what remains.
Well, I made a speech not a couple of years after we came home from the White House, and Herb Pardes was in the audience, and he was I think NIMH when Jim was.
He was head of NIMH.
Mm-hmm, when Jim was president, and he was in the audience. I didn't know it, but I got a letter from him saying, "Don't feel too bad about it," because states. He told me about different states that were taking our recommendations and putting them into force in their states. Anyway, he said that it had made some difference. This was just a few years after, but it didn't make enough difference. Look what's happened, and look how far backwards we went. Well, I don't guess we went backwards, but we didn't go forward. Certainly, if the President's Commission in '78 and the President's Commission in 2002 made the same recommendations.
What do you make of that commission in 2002? That was under the second President Bush.
That's right.
And it was a commission that was very interested in medication and also at the same time interested in empowering patients in some ways. What do you
I don't know. I spoke to them not too long before they published the recommendations. They had been working some with the man who headed it. He was a chairman of it. Anyway, he goes to my mental health symposium at Carter Center, so I knew him well. He was a mental health commissioner in Ohio, I think, and I know his name.
I'm not going to help you.
Yeah. Well, I know his name, but he's good. He's really good. But I told him that the difference in our commission and this commission was recovery. I mean, that's the thing that's happened, the greatest thing that's happened, that we can now know that people can recover from mental illnesses. And that's what they used as the theme of the commission, so I was pleased with that.
Recovery is one of those interesting issues, and I do want to hear a little more about it. I think it is a wonderful concept. It occurs sometimes. I think sometimes also, though, the notion that people should be recovered rather than just somewhat better gets doctors to pursue illness so vigorously that there's a piling on of medications and so on. And I wonder what exactly recovery ought to mean.
Well, recovery doesn't mean they're cured, but people can recover just like you can from high blood pressure. You take your medicine all the time, so your high blood pressure doesn't get worse. And people with mental illnesses can take their medicine and live a full and fulfilling life, a full and contributing life. But what's so exciting to me is the consumer movement. I've seen so much of it with, to go back a little bit, Judy Chamberlain wrote a book in 1978 entitled Own Our Own, something about a patient's alternative to mental health care. She thought that that people living with mental illness ought to have some say-so about their treatment. And we got her to come and report before our committee. And then she helped work with our committee. And for the first time, we had a section on human and legal rights of people with mental illness. We had a whole section on that in our 1978 report. But she started having meetings with consumers and discussing having some say in their treatment. Anyway, two of those people in the early movement with her, one is on my mental health task force at the Carter Center. He started the first consumer section of the Alabama state government. One that I work with all the time at the Carter Center started the first, he was one of them too. Both of those, one had schizophrenia, Joel was totally out of it for 8 years in hospitals, and in hospital for 2.5 years, and in and out of group homes and everything. He's recovered. He has his consultant business now. He's the one that I was telling you about, is teaching respect to the
Yes.
doctors and nurses in Georgia.
Yes. I actually wish I remember his name, because
Joel Slack.
I had him on a radio show when I was hosting a radio show.
Mm-hmm. And the other one was one of those early people, and he had bipolar, and he said he did outrageous things because he thought God was telling him to do them, and he tried to do them. He lost his wife, he lost his business. He was for 7 or 8 years too, and he said after 2 attempts of suicide and the 3rd hospitalization, he decided, he made another pact with God that he was going to go to new places and see new things and meet new people. And he started taking this lithium, and then he started writing and getting some money from his books. He started the first consumer program in Georgia, and also he said this is what made all of the difference. He was able to get, we had a good Democratic governor back then. He was able to get Medicaid to pay consumers to work with other consumers, recovered consumers.
Yes.
We now have in Georgia over 500 certified consumer 500 certified peer specialists, and they're getting paid by Medicaid to work with those who are not recovered. And I had one young man that had been talking to. I wrote about him in my book, and I got him, and now they have their own health and wellness center, and it's just one in the state now, but they're working around the state, and I sent him over there. I think they can stay for 2 weeks, maybe 2 weeks. Anyway, he'd been having all kinds of trouble, and I would talk to him, and he had a policeman anyway, who had gone through the crisis intervention training on how to recognize people with mental illness so that they go to the mental health facility instead of to jail. And he would work with him every once in a while. This young man lived with his grandmother, and she would have to call him because he was acting out. But he went to that place, and he's just a totally different person. And he could not thank me enough for sending him there. He said, I've been all kinds of group homes, I've been everywhere. But now, it's just changed. I mean, I see it. I have seen it. It is so great.
We worry so much about federal involvement in healthcare. At least it seems there's a debate in this country in which people do worry, and it did strike me as extraordinary that Medicare was flexible enough to Medicaid. I'm sorry, to be allow peer counseling as a recognized service.
Well, it's in a lot of states now. That's what he's doing now, going around the country, getting them to other states to adopt it. And Medicaid, I think, depends on what the governor of the state says.
Yes. We have a number of questions from the audience, and some of them are in the same area, and they overlap with a question I asked you before we came out here, which is what you make of the debate over medication. There's so much worry, some quite legitimate, about the role of big pharmaceutical companies in influencing what research is published and doctors' views of medication. Debate about whether children in particular are over-medicated, as well as concerns that people don't have adequate access to medication when they need it. And I think, where are you with that? What is your notion?
I think with children particularly, well, there is a debate in the whole mental health community.
Yes.
I don't think anybody has good answers to that, but I think with children, we don't know. I mean, I don't think children have had medications like they're having now long enough to have the research or to know what's going to happen to them in the future. But the only thing I do know is that so many children have been helped that I would hate for them not to be taking medication.
Yeah.
But one thing I think that has to be done is to monitor the child continuously when they're taking some kind of medication, just to watch for any kind of sign of trouble.
Right. That seems to me, with a lot of science uncertain, the one thing that's well established, that if you're going to give medication, you need to monitor people, children and
That's
adults
right.
both.
And also parents should not focus entirely on medication and not go for therapy too.
Yeah.
That's important.
That's right. And I think that in some ways there's another set of questions about the insurance industry. The insurance coverage seems to favor medication over psychotherapy, that insurers are afraid of what happens once they start allowing a good deal of psychotherapy. And I wonder what you think about that. I'll see if I can find the exact question here, but the gist of it is to what degree people, even with insurance, can actually get adequate mental health coverage in an age of parity.
Mm-hmm. I don't know whether they get appropriate coverage or not. I think insurance companies do favor medications, and insurance companies try to get away with covering somebody with spending as little money as they can spend. It might be that it probably is that psychotherapy is more expensive than medication, so just give them medication.
Yeah.
I think.
Yeah. But we don't know.
You can
I think
tell that
over the long run it might be.
I get so upset with insurance companies. I know how long and hard we worked on trying to get parity, and we had to get statistics showing that from companies that covered their employees, showing that it didn't break the bank.
Yes.
And it didn't matter how many we got, they still wouldn't look at us. I thought no officials wouldn't, and they listened to the insurance companies, and so the whole insurance issue just rubs me wrong.
That does seem one of the areas where research has very little effect. That if you show that there's savings to be had with putting some money into mental health care, it's not convincing.
What do you think?
That would be a whole other interview, but I am a big fan of psychotherapy. I taught psychotherapy at Brown for 15 years, and I think it is very cheap relative to the benefits that people get from it. And especially this intensive work with people with serious mental illness that you often can make big leaps with people who have not been exposed to psychotherapy.
I have a question for you. Our grandson, we have a grandson with depression. He's has medication. He's fine. He's a junior in college and making good grades. 2 days ago, one of his classmates died. We haven't found out whether it was suicide or not. Now, this is his high school graduation class. He's a junior in college. This is the 9th young person to die of his close friends. 5 of them were suicides.
Oh my goodness.
What do I do? What do we do about him?
You know.
I called the National Guard hotline, but I've just been in this session talking with the National Guard, and the woman from Georgia was there, and she said she was the hotline for Georgia. I called. I wouldn't give him his name because I think it would hurt him more for somebody to call him than it would. I mean, I just don't want them to call him now, but I wanted to know what to do. I
that people with mental illness are vulnerable, and they both, it's true that they're vulnerable, and also in some way that's partly understandable and partly maybe less understandable. They are more exposed to stress than other people, to terrible events. And I think you know the answer to your own question, which is when things like this happen, it's important for people to step up, see what's going on, talk. Don't just cross your fingers and hope that things are going to be all right. That someone whom he trusts ought to be able to talk to him and continue to follow up. And it certainly does happen that at these times doctors have to adjust medications or increase the frequency of visits if there are visits. And I think one reason that you asked about psychotherapy earlier, and I think we're having we're preaching to the choir, that one reason psychotherapy is important is it's important to have one of these ongoing relationships based on trust that's there when things go wrong, as they do.
He has that.
Yeah.
And our son and his wife have, every time this happens, they have all his friends together, because they're friends of the ones that die too. They get them all together and keep them, and they stay at their house for spend the night parties and things, to be together. But it's frightening to me.
It is frightening. I think this is, I don't know if this is a good place to come to a conclusion. It is, you make it entirely clear spontaneously that this issue is one that affects everyone. There isn't anyone in any family who does not have members who need help, and that extends from these diseases that luckily we're really quite well able to treat. I think one of the complexities for mental health services on college campuses is that they are today getting young people who maybe wouldn't have been able to go to college at all. So they're getting a collection of people who are, thank goodness, more vulnerable in the sense that means there are opportunities for the more vulnerable. That these issues are universal and extending to diseases that we're much less good at treating, which also are in all families. I don't know if you want to stop by saying something a little about the special interest of the Carter Center in mental health and what programs you're involved with and which ones you think are especially important.
At the Carter Center?
Yeah.
Other than mental health?
I'm sorry?
Other than mental health?
No, in mental health.
In mental health. I don't know, we had the first conference on prevention. How many years ago, Kathy? I think it was 1999 or 2000 or something like that. Anyway, we invited everybody in the world that we knew who had worked on prevention. And it was one of the most fascinating things I've ever seen. They came, 85 people came from overseas at their own expense, like the head of the NIMH of Germany and of Netherlands, and it was just really wonderful. They got so excited about it. We don't have any special program on prevention, but let me tell you this, because this is exciting. Georgia has been under court order to do something about the mental health system since the Olmstead Act, which was, I think, 1999. That said that every disabled person had to be in a community setting, in a good facility close by, or something like that. I don't know exactly what it is, but it was for a community center. And Georgia just never complied. And then in 2007, I think, the Atlanta Journal-Constitution did this big expose of our state hospitals. 136 people had died. One 14-year-old girl from bowel obstruction. Bowel obstruction. Bowel obstruction. And I mean, for things that should not have happened. And so NAMI got the Justice Department to investigate. They did. And they told them they had to provide community centers. To make a long story short, the Carter Center, we got involved. This is the first time we were involved in local. We work on stigma and trying to influence legislation, to influence good health for people with mental illnesses. But we got involved with that because the advocacy groups asked us to, and the advocacy groups were split, and they never worked very close together. So we got involved, and we started to get others, like I spoke to the Pastors Association in Atlanta, which states in most of North Georgia. We spoke to the Sheriff's Administration, got the sheriffs, just different organizations. We got a big lobbying group and working against the state. And I even had the state and the federal government, the judiciary, meeting at the Carter Center. Anyway, on October the 19th, I'll always remember because it's the same as birthday. The Bush administration, like 24 hours before he went out of office, had handed down a settlement to go back. And that's what we were fighting now, because we didn't like the settlement. It just said people had to have services when they left the hospital, but they didn't say what kind, anything. That's just what it said. They did it hurriedly. And so, anyway, the judge was on our side, and on October the 19th, they handed down the settlement came in, and they said that Georgia now has to provide community services for every person in an institution. It has to be done by 2015. We got a long job ahead. But there are states all over the country that have the same kind of cases that are lined up. So now it's going to go nationwide. I'm so excited about it because if we can get people out of those institutions into the community, I think everything will change.
I think this is a terrific note on which to end. Thank you, Mrs. Carter, for spending the afternoon with us. Mrs. Carter is going to be signing books outside the hallway here. If you would remain seated and let her find her way there. There are books for sale in the shop, and she'll be doing signings, and you'll be able to say a word to her then.
Good, I enjoyed it.
Good, thank you. I did as well.
Thank you. Thank you.
Good, thank you.